NEET PG is just round the corner, and what are the most important topics from which NEET PG 2026 is going to set the question? For that, you will have to study the NEET PG 10 years previous year topic list because they mostly focus on the previous year topics. This list has two highlights. One is the yellow highlighter that has come more than four number of times. Another is the blue highlighter that has been repeatedly asked at least two times in the last three exams. And all the recent years from 2023 to 2025 have been marked with 23, 24, and 25. If you want this list, you can purchase it from the link given in the description box below and pinned comment section, and I will give the highlighted topics separately in my free Telegram channel. You can join from the link given in the description box below and pinned comment section if this video has 100 new subscribers. So if you are new to this channel, then do consider subscribing. Anatomy, muscles of mastication, the action of the muscles of mastication is very much important. Muscles of larynx, video based questions can be asked on muscles of larynx. Pharyngeal arches is very much important. Fertilization, development of heart, nerve and nerve palsies, both the upper limb and the lower limb nerve and nerve palsies. Types of epithelium, recently the transitional epithelium or the urothelium came in NEET PG 2025. It is also given in my digital image bank. You can check that. The link is given in the description box below and pinned comment section. Types of joints, muscles of hand, intrinsic muscles of hand is very much important. Facial nerve, the glute and the active transport mechanisms is very much important. Membrane potential has been asked in 23 and 24. Lung volumes and capacities have been asked in 23 and 24. Image based questions can be given with lung volumes and capacities. JVP and anomalies integrated with medicine question can be given. Secondary messengers is very much important for physiology and pharmacology. Difference between obstructive and restrictive lung disease. VQ ratio is important. Mechanism of action of hormones, the secondary messengers they use, it is important. Biochemistry, ketosis has come 23 and 25. Glycosphingolipidosis has come in 24 and 25. Inborn metabolism errors integrated with the pediatrics is very much important. Biochemical tests, video based questions can be given for the biochemical tests. Inhibitors of etc is important. Glycogen storage disorders is very much important. Glucose transporter as mentioned. Aromatic amino acid phenylketonuria, repeatedly twice it has been asked. Genetics is important more for the INICET aspect. Hyperlipidemia has come. Gene repair defects. Vitamin is very very important, and micronutrients. In microbiology, drug of choice of various bacterial infection is important. Diphtheria toxin is important. Neisseria has come repeatedly. Satellitism. Leptospira is very very important, and it has come three times, 23, 24, and 25. So it is very much high. Bacillus anthracis is important. Leishmaniasis, filariasis, dengue in medicine aspect, cerebral malaria, these all come very frequently. In pharmacology, drug interactions and clinical trials is very much important. Atropine is important, anticoagulants, anti-glaucoma drugs, beta blockers. Clonidine has come repeatedly, antiarrhythmic drugs, drugs causing QT prolongation. All antimicrobials, at least you need to know the mechanism of action and the side effects. Malaria treatment, TB treatment, post exposure and pre exposure prophylaxis. One new update is there that lenacapavir, which is a capsid inhibitor, it is approved for pre exposure prophylaxis, 6 monthly interval subcutaneous injection. This can be asked in the NEET PG. Antifungals and their classification, anti-diabetic drugs and their side effects. Monoclonal antibodies is very much important. This free PDF of monoclonal antibodies is also there. You can check it from the link in the description box below. Injuries, laceration, bullet mark, and the range has been asked twice. Early and late postmortem changes. all types of asphyxial death, seminal staining, arsenic poisoning. Important BNS sections are important. Rape and sexual assessment of victim examination is important. Consent is important. In pathology, metaplasia, Barrett's esophagus, proto-oncogenes, Marfan syndrome has come twice recently. APML, Hodgkin's lymphoma, paroxysmal nocturnal hemoglobinuria, hereditary spherocytosis, these have come recently. Pneumoconiosis, inheritance patterns in eye, optic pathway and the lesions, types of glaucoma management, ophthalmos has come recently. Dermoid cyst 23, 24, and 25. Again, another topic that has repeated three number of times, but this time I think it is unlikely to ask on dermoid cyst. Scleritis and episcleritis difference is important. ENT, the tests of hearing has come repeated number of times. Otosclerosis is important. Sinusitis and side effects, foreign body. Psychiatry, types of delusion, substance use disorder is very much important, especially the alcohol. In anesthesia, three questions usually come, and two questions are from BCLS, ALS. And this time also high chances any video regarding intubation or steps of ACLS, PLS can be asked. So video based questions can be asked. If you want to get access to video based questions and important videos, then you will have to join my pro Telegram channel. The link is given in the description box below and pinned comment section. Oxygen delivery devices, it was more oftenly asked during the COVID era. Orthopedics, the named fractures and splints, spondylolysis, spondylolisthesis, Duquesne, stenosynovitis, Angst-Swan is very much important, and osteoporosis is also important. Rickets have come recently. In dermatology, annular lesions, DD, leprosy is very much important. I can assure you one question at least from leprosy or STD is going to come. Psoriasis is important. Bullous disorders is also important. Radiology, system scan has been repeatedly asked. Chest x-rays regarding various conditions can be given. Video based questions with ultrasonography or echocardiography can be given. Medicine, ECG based questions with AFib, PSVT, hyperkalemia, HOCM, ECG of MI and its management, biomarkers, acid base balance disorders. This you are surely going to get acid base balance disorder because every year one or two questions are asked from acid base disorders. So ABG analysis is very much important. Respiratory system, pneumothorax, asthma, TB, hepatitis B antibodies. From that image based question can be given. CSF findings, SACD, stroke and its management, meningitis, types of meningitis and how their CSF findings are different can be asked. ABG, as I have mentioned, craniopharyngioma, DKA and its complications, that is honk management and diabetic ketoacidosis management. Dialysis disequilibrium syndrome has been asked in 23 and 25. Addison's disease, repeatedly asked. Dengue, as mentioned in the microbiology, it is very much important. Pediatric cephalhematoma and caput succedaneum difference, APGAR score is very much important. Biliary atresia is important. Here the milestones are not that commonly asked, but in video based question that can be asked. In OBGY, clinical signs of pregnancy, ectopic pregnancy, MTP, physiological changes in pregnancy, pregnancy induced hypertension, LSCS indication. Some of the maneuvers can be given as video based questions. I have provided them in my pro Telegram channel. In gynecology, cervical cancer staging, some images can be given of cervical cancer and you need to diagnose which stage, or from the radiological finding which stage it is. Pap smear and its management, ovarian cancer, ovarian tumor, how to distinguish between an ovarian cyst and a malignancy of ovary, you will need to know from USG. Vaginal discharges, very much important. Endometriosis is important. Uterine prolapse, contraception is very very important. One sure short question from contraception is going to come. Mullerian abnormalities is important. Bartholin abscess has come repeated number of times. In surgery, Q SOFA, ATLS, GCP, GCP scoring, you need to calculate the GCP score, so it has come repeated number of times. E-fast videos can be given where fluid collection shows that the E-fast is positive, so it can be given. The brain trauma, subdural hemorrhage, epidural hemorrhage, and diffuse axonal injury is very much important. Ulcers, tropic ulcer, arterial ulcer, and venous ulcer, you need to differentiate from the given image. Aortic dissection has come repeatedly. Raynaud's phenomena has come repeatedly. CEAP staging, thyroglossal cyst, video based question, deglutination, and the cyst is moving, and on protrusion of tongue also the cyst is moving. So that is a case of thyroglossal cyst. A video based question can be given. All the clinical maneuvers of thyroid assessment or the clinical maneuvers regarding medicine and surgery, that could be given as video based questions in this session. Colonic polyp and colonic cancer, achalasia cardia, papillary thyroid cancer, hydrated cyst of liver is important, choledochal cyst is important, Todanis classification, staging and management of breast cancer, very very important. Paget's disease has come, extramammary Paget disease can also come in future. Omphalocele versus gastroschisis, urinary stones types, TB kidney, urethral trauma, Fournier's gangrene or Milanese gangrene can be given. Burn classification and management is very much important. In community medicine, the generation time, all the developmental indexes, PQLI, HDI, MDPI, GHI, these are you need to know. The government health schemes are important. This time in the FMG, some of the video based questions were given showing the logos of who. So, some video based questions showing logos of governmental health schemes can also be given in this year NEET PG, because the FMG topics of recent session is very much important for the NEET PG. So, do the FMG topics very thoroughly. Anemia Mukt Bharat came in 24 and 25, and I am going to bet on this that it can come in 26 also, because there has been update in Anemia Mukt Bharat. From 6 into 6 into 6, it has been transformed to 7 into 7 into 7. So this is very much important. Parametric and non-parametric test for biostats is important. Vaccines and vaccine vial monitoring is important. Lead time, screening time is important. Sensitivity, positive predictive value, negative predictive value, specificity. Vectors, images can be given as image based questions. Biomedical waste management is very much important. Disaster cycle and management is very much important. So this is up for today. Now you can watch the video on how to tackle the new pattern of NEET PG exam. All the best for your NEET PG exam.